अस्सलाम वालेकुम एंड गुड आफ्टरनून। कैसे हैं आप लोग? वी आर डिस्कसिंग अबाउट हीमोडायनामिक डिसऑर्डर्स, जिसमें हम एडिमा के बारे में डिस्कस कर रहे थे इन लास्ट लेक्चर, राइट। तो अभी हम उसको कंटिन्यू करते हैं। हमने एडिमा के बारे में डिस्कस किया कि एडिमा बनता कैसे है, क्या पैथोफिजियोलॉजी है उसकी, क्या चेंजेस आती हैं, ऑर्गन स्पेसिफिक क्या है, लोकेशन बेस्ड क्या है, एंड पैथोफिजियोलॉजिकल क्लासिफिकेशन के बारे में भी हमने डिस्कस किया है। एक शॉर्ट सा गो थ्रू कर लेते हैं, रिव्यू ले लेते हैं। वालेकुम अस्सलाम तला, और उसके बाद इंशाल्लाह हम ऑर्गन स्पेसिफिक के बारे में डिस्कस करने वाले हैं, राइट। ओके, moving towards our lecture, we have defined edema as abnormal or excessive accumulation of free fluid in the interstitial space or serious cavities. कैविटीज में हमने पेरिटोनियल कैविटी के बारे में डिस्कस किया था, पेरिकार्डियल कैविटी के बारे में डिस्कस किया था, प्लूरल कैविटी के बारे में हमने डिस्कस किया था। ठीक है, अगर कैविटीज में भी इधर फ्लूइड अकमुलेट है, दैट मीन्स देयर इज ए ऑर्गन स्पेसिफिक एडिमा। तो उसको हमने डिफरेंट नेम दिया, लाइक पेरिटोनियल के कैविटी के अंदर अकमुलेट है तो दैट इज नोन एज एसाइटिस। अगर लंग्स की कैविटी के अंदर अकमुलेट है तो दैट इज नोन एज प्लूरल इथियन। एंड इफ excessive fluid is present in the precardial cavity, so that is known as pericardial ichthyum या hypopericardium, right? वालेकुम अस्सलाम, आ रही है? So will be fine. Okay, very good afternoon, Samar. Instead of that, we also defined edema as a palpable swelling produced by expansion of interstitial fluid volume. And in medical terminology, swelling caused by collection of fluid in small spaces that surrounds the body tissue and organ, also known as Walaikum Assalam, beta. Well, तो फ्लूइड कितना इंटरस्टिशियल स्पेस के अंदर अकमुलेट होना चाहिए? दैट इज अराउंड अबाउट 2.5 से लेके 3 लीटर्स। अगर फ्लूइड अकमुलेट है तो दैट इज नोन एज देयर इज अ प्रेजेंस ऑफ एडिमा, राइट। There are certain types depending on the location, clinical findings, as well as the pathophysiological mechanisms. We have defined different types of edema as according to pathophysiological changes. There might be a transudate or exudate. We have already discussed in detail in the acute inflammation. कि ट्रांसोडेट क्या होता है और एक्सोडेट क्या होता है. We have also discussed about the specific gravity of transudate and exudate. Instead of that, depending on the protein content, we also said that transudate have a low protein content as well as the exudate have a high protein content, right? Instead of that, according to location, we have two types. One is localized and other one is generalized edema. And depending on the clinical findings, we have a pitting and non-pitting edema. Walaikum assalam, Niva. Uh, welcome again. Okay, sure. Right. There are examples that we have already discussed, like localized है, generalized है, pitting है, non-pitting है. In these pitting and non-pitting edema, one is variases and other one is elephantiasis. That is a very important, especially in the UHS MCQ questions. Most of the times the MCQs contains like options variases as well as elephantiasis. So keep in your mind that filariasis क्या है? Filariasis basically है Giardia bancrofti is a parasite that lives in our crown area. During its life, ये lymph को तो destroy करता है, but when it is dead, that releases endotoxins. Endotoxins क्या करती हैं? उस lymph vessels की inflammation cause करना शुरू कर देते हैं. That is known as lymphangitis. और जो lymphangitis है, once there is a lymphangitis, means the lower extremities are swollen. क्यों? क्योंकि वहाँ पे जो lymph होता है that will be accumulated and the leg of the human being is look like elephant's leg, that is known as elephantiasis. Okay, so pitting edema, early stage of filariasis, and non-pitting edema is elephantiasis, right? Okay, let's take we have a brain. If there is a edema in the brain, we have to know about the medical terminology that is cerebral edema. We can't say there is a brain edema. Yeah, there is accumulation of fluid in the brain. Like hydrocephalus is something else. There is a fluid accumulate in the brain. If there is a edema in the brain, we can say that there is cerebral edema. And if we talk about the lungs, the fluid accumulates in the intraalveolar spaces that is known as pulmonary edema. If the fluid is accumulated in the pleural cavity, either it is known as pleural effusion. If the fluid is accumulated in the intrapleural cavity, a pleural space, visceral और parietal pleura के दरमियान अगर fluid accumulate है, that is known as pleural effusion. और अगर intraalveolar space के अंदर accumulate हो तो that is known as pulmonary edema. Instead of that, we have fluid accumulation in our peritoneal cavity known as ascites, and if there is a massive and generalized edema known as anasarca, right? Well, these are certain causes of edema that we have already discussed about. The increased hydrostatic pressure is one cause, and another one is reduced or decreased plasma autopotic pressure or osmotic pressure, and third one is lymphatic obstruction, fourth one is sodium retention, and the fifth one is inflammation. And we have already discussed about acute and chronic inflammation and angiogenesis, in which mostly in acute and chronic inflammation there will be a increased vascular permeability. And once there is increased vascular permeability is increased means the gap junctions are increased. Thus, the space between the gap junctions are increased. And angiogenesis means that there is a formation of new blood vessels that are leaky. तो लीकी होने की वजह से there will be a edema formation, right? Oh, okay, that is a pathogenesis of edema, how the edema occurs. We have already discussed about there might be imbalance between plasma protein concentration, interstitial fluid, or lymph flow. When there is an imbalance between plasma protein, hydrostatic pressure, and lymph obstruction, there might be edema. And there are certain tissue factors. One is increased osmotic pressure, oncotic pressure of interstitial fluid and decreased tissue tensions, increased capillary permeability, and sodium and water retention is very, very important, especially patients who are suffering from the renal failure and heart failures. The edema is generalized edema because when there is a decreased cardiac output means the blood supply towards the kidney is reduced. There might be ischemia. अगर ischemia होएगा तो ultimately at the end there is a secretion of aldosterone. And aldosterone क्या करेगा? It will retain the sodium and water content. And instead of that, if there is a decreased blood pressure, if there is a decreased cardiac output, especially in the congestive heart failure, so again RAS system is activated. And when there is a RAS system activation, that will again leads to accumulation of water and sodium. That will lead to a generalized edema. Instead of that, if the person is suffering from liver cirrhosis or liver failure or a hepatocellular carcinoma, means there is a reduced protein synthesis, especially albumin. जब albumin की synthesis will be reduced, definitely oncotic pressure will be decreased, and ultimately there will be an edema, and that edema is again known as generalized edema, right? Okay, that slides we have already discussed. That is a summary. Like either it is extrarenal, intrinsic renal, intrarenal, or it may be a ADH mechanisms. These three mechanisms simultaneously triggers and leads to edema formation. If there is a decreased blood pressure in the form of hypovolemia or decreased cardiac output, or there is a hypotension, these mechanisms are triggered. Yes, definitely सुना बेटा. Liver cirrhosis से definitely ascites होती है. ओके, इसके अलावा बेटा तरफ जो वेन्स सप्लाई कर रही हैं इंट्राहेपेटिक अगर ब्लॉकेज हो रही है तो दैट विल आल्सो लीड्स टू ascites. For example, FASPA effect का पता है सना? If you know about the FASPA effect, then you have to know about the ascites as well. जब आप खाना खाते हैं, खाना खाने के बाद खाना आपका लीवर की तरफ जाता है और वो GIT से vessels लेके जा रही होती हैं. If there is a blockage in the liver or there might be a liver cirrhosis, ultimately ascites will occur. और उसमें प्रोटीन दी जा रही होती है पेशेंट्स को, ठीक है, क्योंकि लीवर से प्रोटीन सिंथेसाइज हो ही नहीं रही होती. ओके, गॉट इट. Mechanism of edema formation, we have 5 mechanisms instead of that. Might be other causes are also there. One is increased hydrostatic pressure, that will lead to edema. Second one is reduced plasma oncotic pressure, that definitely will lead to edema. Or lymphatic obstruction like elephantiasis, filariasis, that local obstruction that will also in edema formation. And lymphatic obstruction के अंदर one is filariasis, lymphangitis and elephantiasis. ये 3 चीजें आप लोगों ने रखनी है माइंड के अंदर. Sodium and water retention, how that occurs, that is mechanisms and arrow shows that will lead to edema formation at the end. Hypovolemia is there, ultimately renal vasoconstriction will be there. Decreased GFR definitely will lead to renal retention of sodium and water. If there is a hypovolemia, ultimately renal will be released, aldosterone will be secreted, and renal retention of sodium and water will definitely lead to edema. One more thing you have to add in that thing, if there is a low level of sodium, a low content of sodium, then definitely renal will be released, aldosterone will be secreted, and at the end renal retention of sodium and water will be occurred, and that will lead to edema. Right? Hypovolemia, decreased blood pressure, instead of that low content of blood sodium, or hypotension. These are the triggers that will stimulate the RAS system. If there is abnormal stimulation of RAS system, ultimately that will lead to edema formation, either in the congestive heart failure, the person is suffering from congestive heart failure or heart failure. Ultimately, there will be decreased cardiac output because in the heart failure, the heart is unable to pump all the bloods coming towards it. Or ultimately, that will lead to decreased cardiac output. When there is a decreased cardiac output, there might be a renal ischemia, and renal ischemia will trigger RAS system, right? Well, fifth one is inflammation. We are talking about the endothelial gap junctions. Once they are only permeable to water, once the gap junctions will widen, it means the plasma proteins will also escape from these junctions, and they can generate their own pressures. They can make their own pressures, oncotic pressure in the interstitial space and water. And once the water is accumulated in the interstitial space, we can say there is a edema. Got it? Okay, moving towards renal edema. Renal edema क्या हो सकता है? Like generalized edema occurs in certain diseases of renal origin. Like nephrotic syndrome is here, some types of glomerulonephritis, like nephritic syndrome and renal failure due to acute tubular injury. Type 1 is nephrotic syndrome. What is nephrotic syndrome? Characterized by persistent and heavy proteinuria. And proteinuria ultimately leads to hypoalbuminemia. Once the protein is lost in the urine, that is known as proteinuria. Or in the proteinuria, especially albumin is lost. And once the albumin is lost, we have hypoalemia. And albumin maintains the oncotic pressure. When there is a decrease in the plasma protein albumin, definitely there is a decrease in the oncotic pressure. resulting in severe generalized edema. Also, there is activation of renal angiotensin aldosterone system or mechanism, which results in retention of sodium and water as well. Got it? These vicious cycles which persist till the albuminemia continues. ये तब तक चलता रहेगा जब तक albuminemia is present, albuminuria is present, and classically more severe in the subcutaneous tissue as well as in the visceral organs. Ultimately, edema will occur. It may be a generalized edema and it may be a organ specific. Like one of your fellow was asking about the liver cirrhosis. If there is a nephrotic syndrome, there is a low content of plasma protein. It will also lead to ascites. It will also lead to generalized edema. Okay, nephritic syndrome. Conditions such as acute diffuse glomerulonephritis, rapidly progressive glomerulonephritis like nephrotic syndrome, nephritis and nephritic edema. There is excessive reabsorption of sodium and water in the renal tubules via renal angiotensin mechanism. However, if there is a person is suffering from nephritic syndrome, mean there is a acute diffuse glomerulonephritis and rapidly progressive glomerulonephritis will lead to nephritic edema. In that in that case, again the water and sodium will be reabsorbed in excessively through renal angiotensin mechanism. Yeah, angiotensin system. While as compared to nephrotic syndrome, if we compared with the nephrotic syndrome, then in the nephritic syndrome, the edema, yeah, nephritic edema will be mild. Begins in loose tissue such as on the face, around the eyes, ankles, and genitalia. You can make a differentiation between the nephrotic and nephritic syndrome. Yeah, nephritic edema. The edema will be mostly present in the face, around the eyes, ankles, and genitalia. Okay, other thing is acute tubular injury. Okay, acute tubular injury following shock or toxic chemicals. If there is a accumulation of toxic material in the tubules, there might be a toxic injury. And if there is a ischemia or there might be a vasoconstriction, a renal vasoconstriction that lead to ischemic injury. Acute tubular injury दो वजह से हो सकती है. One is ischemic cause, other one is toxic cause. If the toxic material accumulates in the renal tubules will be injured. And other one is if there is a ischemia, damaged tubules lose their capacity for selective reabsorption and concentration of glomerular filtrate. Definitely yes. Once the tubules are damaged, means they have lost their capacity for selective reabsorption and concentration of GFR, resulting in increased reabsorption and there might be oliguria. What is oliguria? And that will lead to excessive retention of water and electrolytes and rise in blood urea. What is oliguria? Decreased urine output. कितनी नॉर्मल यूरिन आउटपुट कितनी होती है 0.5 से लेके 1 ml per minute per kg per minute. Okay. Another one is cardiac edema. नेफ्रोटिक नेफ्राइटिक या रीनल एडिमा में कोई क्वेश्चन किसी चीज़ को समझ नहीं हो तो लेट मी नो पूछें. Okay. After that we are going to discuss about cardiac edema. What is that? Okay. Well, cardiac edema generalized edema होता है basically caused by due to right-sided and congestive cardiac failure influenced by gravity. If it is influenced by gravity, definitely it is a dependent edema. Reduced cardiac output causes hypovolemia, which in turn activate intrinsic renal and extrarenal hormonal renal angiotensin aldosterone mechanism, as well as ADH secretion, resulting in sodium and water retention. कार्डियक एडिमा हमने ये वाली डायग्राम में डिस्कस की है। ये कार्डियक एडिमा के अंदर अकर हो रहा होता है, हार्ट फेलियर के अंदर अकर हो रहा होता है। And there is a hypovolemia, there is low cardiac output, there is a hypotension. Ultimately, these mechanisms are activated, and that will lead to edema, high blood pressure. Well, instead of that, back pressure hypothesis, like right-sided heart failure, these are. अब इसमें हमने हार्ट फेलियर के बारे में बात की है, कार्डियक एडिमा के बारे में डिस्कस किया है, reduced cardiac output की वजह से, and other one is back pressure hypothesis. Back pressure hypothesis like right-sided heart failure. Forward में sorry back pressure hypothesis में right-sided heart failure है, elevated that will elevate the central venous pressure. CVP will be raised and transmitted backward to the venous end of the capillaries, raising the capillary hydrostatic pressure, and consequently transudation will be occurs. Transudate will be formed. And forward pressure hypothesis like chronic hypoxia, injury the capillary wall. Once there is an injured capillary wall, that means there is an increased vascular permeability, causing increased capillary permeability and resulting in edema. This theory lacks support since the edema by this mechanism is exudate, whereas the cardiac edema is typically transudate. Got it? The cardiac edema is typically transudate, but this theory says that the edema in this mechanism is exudate. What is the difference between transudate and exudate? And the question for UHS is transudate and exudate. Okay, pulmonary edema. Most important form of local edema causes serious functional impairment. For example, कैसे अगर तीसरा पार्टल प्लूरा के दरमियान फ्लूइड अकोमोडेट हो गया, that will lead to decrease expansion of the lungs. If there is an intra-alveolar edema, ultimately it will lead to decreased gases exchange. Etiopathogenesis, like elevation of pulmonary hydrostatic pressures and increased capillary permeability. Once there is the elevation in the pulmonary hydrostatic pressure, and ultimately, if there is a increased capillary permeability, that will lead to intracellular as well as intracellular edema or pleural effusion will occur. That's why it is called pulmonary edema. Right? Okay, elevation in pulmonary hydrostatic pressure. What are the causes in the heart failure? There is an increase in the pressure in the pulmonary vein, which is transmitted to pulmonary capillaries. For example, if there is a heart failure, लंग्स के अंदर जो ब्लड नहीं जाना है, हार्ट फेलियर होने की वजह से वो वहाँ पे अकमुलेट होना शुरू हो जाएगा फ्लूइड, and this causes imbalance between pulmonary diastolic pressure and the plasma oncotic pressure. Definitely yes. And excessive fluid moves out of the pulmonary capillaries and to the interstitium of the lungs. These are cleared by the lymphatics present around the bronchioles and veins. As the capacity of the lymphatics to drain the fluid is exceeded, about tenfold increase in the fluid, the excess fluid starts to accumulate in the interstitium. ये cause है जिस वजह से pulmonary hydrostatic pressure increase होता है. Like patient is suffering from the heart failure, there will be increase in the pressure in the pulmonary veins, which is transmitted to pulmonary capillaries. And ultimately, once the capillary hydrostatic pressure and there is an imbalance between the pulmonary hydrostatic pressure and the plasma oncotic pressure, definitely it will lead to pulmonary edema. It will lead to pleural effusion, intracellular edema. Well, other one is elevation of okay, prolonged elevation of hydrostatic pressure and due to high pressure of interstitial edema, alveolar lining cells break and alveolar air spaces are flooded with the fluid. And ultimately draining the air out of the alveolus, seriously hampering the lungs functioning. Examples included left heart failure, mitral valve stenosis, pulmonary vein obstructions, thyrotoxicosis, cardiac surgery, nephrotic syndrome, and obstruction to the lymphatic outflow by the tumor or inflammation. These are the causes that will lead to elevation in the pulmonary hydrostatic pressure. And there might be a pleural effusion, there may be a pulmonary edema. Ultimately, there might be a hypoxic condition. Well, increased vascular permeability, however, is that occurs like damage in the vascular endothelium as well as the alveolar epithelium cells via alveolar capillary membrane. If there is a damage in the vascular endothelium, increased vascular probability will be occurred. And excessive fluid and plasma protein leak initially into the interstitium and subsequently into the alveoli. For example, ruminant pulmonary and extrapulmonary infections, inhalation of toxic substances, aspiration,
आपका सेकंड क्वेश्चन भी टाइम आउट हो चुका है
like shock, radiation,
मैंने आपको सेंड कर दिया है
injury,
जो बच्चे को जो 20 नंबर दिया है उसी
hyper sensitivity to certain drugs,
आपके पास नेक्स्ट
RAT serum,
8 मिनट
serum,
को एक्सप्लेन करें 5
uremia and acute respiratory
जो
distress
आपको दी गई
syndrome.
है उसे
These
मतलब
leads to increased vascular permeability in the alveolar interstitium or in the alveoli.
आपको रिपीट कर आप
Ultimately, once there is a increased vascular permeability,
खत्म हो गया उनका अब आपको आखिरी जो क्वेश्चन मैंने दिया है इसका 20 नंबर आपके नाम
there will be a fluid accumulation in the
20 नंबर को
intraalveolar or in the rural alveolar cavity.
एक्चुअली में 5 हेडिंग्स आपने दे दी हैं अस्सलाम वालेकुम रहमतुल्लाहि व बरकातहू
Okay. Acute high altitude edema, it is a form of edema in which the individuals who cling to high altitude suddenly without hearts and without waiting for acclimatizations suffers from serious circulatory and respiratory health effects, particularly at heights of more than 2,500 meters. These changes include like pulmonary edema will occur, congestion will be occurred, and widespread minute or minute hemorrhage will
इसका 5
occur.
नंबर का सवाल है 5 ही नंबर है इसके
And these changes can cause death within a few days. Ultimately, patients will be found no more. If there is a pulmonary edema, there might be congestion, and there might be a minute hemorrhage in the lungs that will reduce the gases exchange. And once the hypoxia is there, ultimately the patients will die within a few days. And these mechanisms occur to anoxic damage to pulmonary vessels. Ultimately, and these are the references, and that's all. Okay, इसमें अगर कोई क्वेश्चन है तो काइंडली जल्दी से पूछ सकते हैं. इंस्टेड ऑफ दैट नेक्स्ट क्लास में हम डिस्कस करने वाले हैं शॉक के बारे में. कल हम शॉक के बारे में डिस्कस करेंगे एंड आफ्टर दैट वी हैव ए क्लास एट 11 10 ना जनाब की मौजी है कोई क्लास नहीं होनी. Tomorrow we will discuss about the shock. Okay, well, छुट्टी है definitely. So then we will discuss shock on 11th Jan. I think either it may be a physical class or it may be a online class definitely. Okay, sure. आज के लेक्चर में क्वेरी एडिमा के बारे में, टाइप ऑफ एडिमा के बारे में, क्लासिफिकेशन के बारे में, प्रेशर्स के बारे में, रियली ओके ओके, जितना हमने पढ़ा है इसको काइंडली रिवाइज कर लीजिएगा एंड after the 11th Jan, if there will be a physical class, then we will make an schedule for tests as well. और मैं टेस्ट स्केड्यूल आप लोगों से शेयर कर दूंगा बिफोर 11th Jan ना एंड बी प्रिपेयर्ड फॉर द वर्स्ट। जो हमने पढ़ा है उसको रिवाइज कर लीजिएगा। अगर किसी चीज़ की समझ नहीं है तो वो मेरे से पूछ लीजिएगा, उसको हम फिजिकली की कुछ चीज़ें डिस्कस कर लेंगे, लाइक द इंट्रिंसिक एंड एक्सट्रिंसिक का जो मैकेनिज्म है वो हम इंशाल्लाह वाइट बोर्ड के ऊपर डिस्कस कर लेंगे, राइट। इसके अलावा ये जो चैप्टर्स हमने डिस्कस किए हैं, लाइक टर्मिनोलॉजीज हैं दैट आर वेरी वेरी इंपॉर्टेंट। इंस्टेड ऑफ दैट सेल इंजरी के बारे में हमने डिस्कस किया था, इन्फ्लेमेशन के बारे में डिस्कस किया था, रिपेयर ग्रोथ के बारे में डिस्कस किया है, दैट आर वेरी वेरी इंपॉर्टेंट। काइंडली इनको सबको देख लीजिएगा। नो टेस्ट ऑनलाइन अगर नहीं होगा, नहीं टेस्ट ऑनलाइन नहीं है, टेस्ट हम फिजिकली लेंगे। ऑनलाइन आप गूगल कर सकते हैं लेकिन गूगल विल नॉट हेल्प इन द यूएचएस, यू नो ना। ओके, टेस्ट ऑनलाइन इंशाल्लाह ले लेंगे, ऑनलाइन नहीं लेंगे बल्कि फिजिकली टेस्ट ले लेंगे जिसमें एमसीक्यू पर एमसीक्यूज, यू नो ना। टेस्ट ऑनलाइन नहीं होगा सना बेटा। इंस्टेड ऑफ दैट और कोई क्वेरी है? ऑनलाइन बेटा लेना ही नहीं है समझ, हमें फिजिकली लेना है। इस दफ़ा हमने टेस्ट डिस्कस भी नहीं करने, बस टेस्ट देना है, सेम डे पे हमने चेक करना है और उसके बाद खत्म। सेकेंड डे पे टेस्ट लेके नहीं जाना। और बेटा नहीं, ये टेस्ट वो नहीं होते जो यूएचएस में आने वाले होता है। टेस्ट लीक हो या ना हो, आई डोंट केयर।
तो बच्चे आपके टेस्ट का वक्त खत्म हो गया, अब कोई आंसर अस्सलाम वालेकुम।
ओके, इसके अलावा और कोई क्वेरी? और बाकी लोग जो क्लास कैंड नहीं कर रहे, दे विल सफर इन द यूएचएस, तो बता दीजिएगा। तो बाकी आप लोगों के लिए अच्छा ओके, इस दफ़ा सेंड आप में वो नहीं आएंगे इंशाल्लाह। इस दफ़ा हमारा अभी टेस्ट हुआ ही नहीं है ना पैसों का, तो इसलिए बी केयरफुल। ओके, तला अटेंडेंस मुझे सेंड कर दीजिएगा, व्हाट्सएप कर दीजिएगा। और जितने लोग प्रेजेंट हैं ओनली 15 है, 15 से ज़्यादा। हाँ, आप ले लो टेस्ट में आपका। अच्छा बेटा ये जब आप लोग आएंगे ना तब लिया जाएंगे। इस दफ़ा बेटा बिल्कुल आएगा। जो जो हम पढ़ रहे हैं ना, मेरा ख्याल है कि जैसे मैं पढ़ा रहा हूँ आपको, मेरा भी ख्याल कि आप लोगों को प्रूव करना चाहिए। डेफिनेटली यू हैव टू बी रेडी फॉर द वर्स्ट। और 15 लोगों की अटेंडेंस, 16 की अटेंडेंस कल मुझे शेयर कर रहा है ग्रुप में। और तला साहब की नहीं कर देना जिस तरह लास्ट आपने किए हैं। अकेले मैं कंसिडर तो कर लूँगा लेकिन काइंडली वो लोग जो प्रेजेंट हैं उनकी ही अटेंडेंस आपने भेजनी है। और फिर इसके अलावा कोई क्वेरी हो बेटा, लेट मी नो, अदरवाइज see you फिर इंशाल्लाह नेक्स्ट क्लास आफ्टर द vacations, after the winter vacations. बाय बाय, अच्छा पढ़िएगा, सोते तो आप बहुत हैं लेकिन फिर भी टाइम पे सोइएगा, खाना टाइम पे खाइएगा, अपना बहुत सारा ख्याल रखिएगा, और दुआएं तो आप करते ही होंगे, और दुआओं में भी याद रखिएगा। सी यू इंशाल्लाह। हाँ ओके, चला मैं अभी आपको बता देता हूँ कौन कौन ऑनलाइन है। जेनिफर है, नफीसा है, तलहा है, कुरातुलैन है, टीका तनवीर है, सनानाज है, जैनब है, कांसा है, समर है, अमारा है, एंड एट द एंड ऑफ दिस वाकिंग है। बस 3 स्टूडेंट्स आर लाइव। चलिए मैं इनका स्क्रीनशॉट ले लेता हूँ पहले। ओके 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 ओके, एक्स्ट्रा डेफिनेटली है, हमारा भी है।